Dan Williams, Survive Outdoors. Today we're going to address three topics. We're going to talk about what is the truth behind antibiotics and their expiration date. We're going to talk a little bit about some COVID facts because I'm getting a lot of questions about that. And we're going to talk at the end a little bit on Ivermectin. Now, why are we doing this? We're Survive Outdoors. Well, I have a lot of subscribers that are preppers. And Survive Outdoors, I am really big on prepping and being ready for an incident, whether it's an injury or a sickness or any illness in the outdoors. So do I prep? Am I a prepper? I definitely prepare, and I have my containers and my bins in the basement, and yes, I do prepare. Now, on any group organization, I mean, preppers get a bad rap. But if you have a bell curve, you're going to have those few individuals that are the extremists on the prepper side, and they get the bad rap, and then what do people do? They generalize and they hit all the preppers. Kind of similar to what's happening in our country today. You know, people that we have a few of the outliers, or more than a few, and we just stereotype the hell out of them, right? That's what we do. And we're at odds and we're split. So what is the truth about antibiotics? And you're going to carry them on a 7-day trip. You leave them in your pack. You have your ibuprofen, your Tylenol. You're going out next year and you forget to change because the expiration date runs out, right? So you forget to switch those out. Is that a big deal? No, not really. So how did this all start? Well, in 1979, under the Reagan administration, he put with the FDA came in and they made mandatory expiration dates, and some of those are 2 years after shipment of the antibiotics and the medication. And so they stuck that in there. Now, my guess is a lot of that has to do with liability, but more of that has to do with this. And the reason why is there is no real investment for a pharmaceutical company to put a 10-year, 15-year expiration date on that bottle of antibiotics because, my gosh, every hospital, every clinic, they just have to replenish it. And this all gets thrown away. It's estimated that approximately, gosh, what is it, 800 million, I believe, would be saved yearly if they would extend these expiration dates. So the long and short of it is that the antibiotic, about 90% of all antibiotics on the expiration date, these things can still show very good efficacy and treat illness up to 15 to 20 years later. That's correct. If it's stored in a dry, cool area, not in your bathroom medicine cabinet, not in your car glove compartment. Now, there's always exceptions, and that's where it gets a little hairy. There's exceptions like pediatric suspension. There is no way that that is going to be that effective over time, especially if you've mixed it and you've put in your sterile water and you've made that suspension. Inhalers, they do not last that long, 2 to 3 years. Nitroglycerin, that is one that will degrade quickly, and that's why it comes in this usually a very small bottle, amber color, so sunlight and other light cannot degrade that medication. They did find EpiPens, which I talk quite a bit about, and junior EpiPens. It was thought that they would only last about a year to a year and a half, and they found that they hold 80% of their efficacy about 4 to 5 years after you've basically get it from the pharmacy. So that's pretty good, actually. But that's not a 15-year medication. Now, there are also some concerns. Doxycycline, Tetracycline, that class of antibiotics, if that is expired, can cause kidney damage. The illness is actually called Fanconi syndrome, and we're not getting into it, but I'm telling you that you have to be careful with doxycycline as well as tetracycline post-expiration. So we're going to leave that right there. So if you research this yourself and you Google expiration dates, antibiotics, what is the truth, you're going to see a lot of recent articles. Can you take expired Cipro. This was 2019, and they say not after 3 years. This is healthline.com. Sounds really good, right? 2018. Does amoxicillin expire? And they basically tout don't take it after 2 or 3 years. This one is, can you take expired antibiotics? And this is 2021. And I'm going to read it here really quickly. Can you take expired antibiotics? 90% of the potency and efficacy of antibiotics can be retained 5 years from the expiration date if stored correctly. But like other medications, antibiotics can expire. This is from prescriptionhope.com. Not true. So why are all of these websites not talking about the actual expiration date? Well, think about it. I mean, these drug companies have a lot of money and a lot of power. So clearly, I'm just really shocked as you are that this is all happening. And to verify that this is not all just fabrication, I'm just talking to the wind here, it was in 1986, the FDA and the Department of Defense came together to work on a drug extension program. It's actually, believe it or not, right now they have a bill set up for the Senate to explore that, to extend the expiration dates. What they did, though, prior to that is they got together with the Department of Defense and said, look, we have all of these medications back here stored for years. We got to find out if this efficacy is still good. And they found out it was for a long period of time. And it saved the Department of Defense millions of dollars. In fact, it came out to be, for example, for every dollar you would spend, it saved you about $677. That, not you directly, but that would be the rationale in terms of how much money they were saving on not rebuying all of these damn medications. However, you can get antibiotics online. There's a few individuals, teledocs now, that are doing this, and there are concerns with that. I just mentioned the doxycycline, I mentioned the tetracycline. There's also issues with when, if you're not in the medical profession, do you know when to take it? One of the biggest problems we have right now, and it is going to get very bad in the next 10 to 15 years, is going to be antibiotic resistance, because doctors, PAs, nurse practitioners are prescribing way too many antibiotics. See it all the time. For sore throats that are not strep throat, for viruses, for colds, bronchitis. 99.9% of all bronchitis is viral. You don't need an antibiotic. So a person comes into the clinic and then they've been sick for 5 days, they beg for an antibiotic, they get the antibiotic, they get better in 5 days, and they say, see, it worked? Well, no, because the virus is only going to last about 10 days total. So if all of these antibiotics are being bought online, then the problem is eventually the antibiotic resistance is going to be ridiculous. And right now there are no new antibiotics that I can find that are being made. It's been about 17 years since I've seen a new antibiotic come on the forefront here. You know, I've just not seen it. So that is a concern. So if you're going to be one of the preppers and or if not, you just want to stock up and you want to have that, please talk to your healthcare provider and discuss when, and get some idea of when you should take this in a dire situation, in a survival situation, or if you are out there in the wilderness, and that's really important. This also holds true for things like ibuprofen, acetaminophen, Tylenol, diphenhydramine tablets, not the spray. That expires quickly. So it's in a different formation. So sprays, creams, those will degrade more quickly. But Benadryl tablets, those will last for years, and they will still have very good efficacy. It's just like with food. So milk, they got an expiration date. That is good for 5 to 7 days post-expiration date. Smell it, tastes terrible, throw it out. So these are some things that I wanted you to think about, really important in terms of what is the truth around the expiration of an antibiotic. So I've got a lot of questions on COVID, and I see over the last 2 years anywhere from 50 to 70 patients a day. And yeah, it's been brutal. 2 years and 2 months, I didn't get COVID, double masked, vaccinated and boosted. And finally, what was it, a month ago? I got COVID and it was very minimal. So a lot of you have been asking me questions. When am I going to put up some facts? Well, here's some factual data. Basically, what I've experienced at the clinic I work. Number one, is COVID, when is it contagious? We know that 2 to 3 days prior to you having recognizable symptoms, you can spread the virus, which is a real drag. We used to think that you could only spread it when you had recognizable symptoms, runny nose, fever, sore throat. We know now that you can still get it 2 to 3 days prior to that. So that can be a little bit of a problem. Most viruses are not contagious until you become symptomatic. This sucker is a little contagious 2 or 3 days prior to, like herpes simplex, the genital herpes. Why is that so rampant? One is because people are grossly promiscuous, having sex, right? The other issue is that even if there's no herpes lesions, that virus can still shed and it can still be contagious. So yes, COVID can be contagious a couple days prior to you becoming symptomatic. How long are you contagious for? You're contagious with this Omicron virus. You know, CDC catches so much hell because they keep changing things. So with the Omicron virus, we're looking at the first 5 days from the day one of your symptoms, you are contagious, and then they recommend wearing an N95 for 5 days. Well, why is that? You definitely are contagious for about 10 days. On the 7th, 8th, 9th, and 10th day, the contagibility is extremely minimal. All right, but yes, if you, on the 10th day, 9th day, 8th day, if you're right there in somebody's face and you cough in their face, yes, the potential of them to get it is there. So that is very true. Why get vaccinated? Because you can still get the virus. Well, the last 5 weeks, on average, I have admitted 1 to 2 patients a week to the hospital, and every single person that went to the hospital that was admitted was unvaccinated. And I had many people that were vaccinated that had Omicron virus, and their symptoms were minimal. They got over it fine. So one of the main reasons is, obviously, it clearly decreases hospitalizations and decreases morbidity and death. No doubt, truth, 100% truth. So that's important to note. Now, should I get this asked a lot? What about under 5? Should I have my kids vaccinated under 5? And I'm really on the fence on that. I really don't see it necessary under 5 years old to be vaccinated. Kids are doing very, very well. However, there's always an asterisk. If the kid has an immune issue, if the kid has some concern or medical problem, if the child is a preemie, they're going to be more susceptible to respiratory diseases. Preemies, their lungs don't develop that quickly as per a full-term child. Those I would highly advise that, and your pediatrician, ask them. They'll advise that they should get vaccinated when that comes out. But for the most part, no, if you have a healthy child under 5, I don't see that being necessary at this point in time. But if you're an adult, teenager, absolutely, absolutely, get vaccinated. It's fine. Not a problem, all right? I'm not even going to address some of the bizarre concerns about, oh my gosh, myocarditis is higher with the vaccine. That's been disproven so many times, I'm not even going to go down that road. So what do I tell somebody that has COVID? I get asked, can I take vitamin C? Can I take zinc? Is that going to help? Not really. Vitamin C and zinc is not going to do really anything. Vitamin C also is a water-soluble vitamin, so it's important to note you're going to pee out 50% of that. You take a gram, you're really only getting 500 milligrams. No evidence, no research is showing that that is helpful And I defy any of my medical followers there. If you find something, please put it down below. Show me, throw me some research data on vitamin C and zinc that shows in a peer-reviewed study that it works. So I tell people, sleep. Your body needs rest. Sleep, 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 rest. Benadryl at bedtime is totally fine. That's going to help decongest you. Humidifier. Do not do Benadryl if you're over 70. Do not do that. Fluids, rest, exercise your lungs. When you can, take some deep breaths, 10 to 15 minutes a day, twice a day. That would be really helpful. And wait. And if you get worse, I mean, you can do some NyQuil at bedtime. You can definitely do some Robitussin over the counter or Delsum to suppress your cough. Not a problem. If you get worse, check with your healthcare provider. Monoclonal antibodies. I've sent quite a few people to the hospital for that, and they did get better quicker. So that is what I advise on treatment. Do masks work? Absolutely. So that's all I'm going to say. Not going to debate that in detail. Yes, absolutely they work. Ivermectin. Yep, it's everywhere, right? Poison control. The phone calls have been insane. This is what happened to me 2 weeks ago. So a 48-year-old male came in concerned he had COVID, and that's what I thought the initial presentation and concern was. We did the test. We did a PCR. PCR test came back positive. I go in. His wife's in the room. Everybody's masked up, and I'm doing my shtick of discharge on COVID, my advice, my suggestions, if he gets worse. And he does not respond. Literally does not respond. Has a very hard time even saying the first word. And I'm a little confused, and I look at the wife, and I'm looking back at him. I said, so how can I help you? Do you have any questions? Silence. Blank stare. Flat affect. Nothing. I'm like, what's going on here? So I find out via wife that basically this is the worry. He was out doing some work on his farm, and basically the next day he was somewhat disoriented and was like this. This is a healthy man and good shape too, on no meds. Found out that they were basically taking around 14 vitamins a day. So I had the whole list to try to help with COVID. And we're talking lysine, zinc, vitamin C, vitamin D, you name it. It was there. I mean, it was a list. And that still wasn't making sense. Something else was going on with this case, and I could not figure out what it was, and I was starting to get worried. So I did something. I checking all the, you call it the psychomotor skills. Could he walk? How was he? Could he do finger to nose? All of these certain things that we look for to see if there's anything else going on with the brain. The motor skills, they were all fine. They were perfect. So I dug and I pressured the wife. I said, look, alcohol, drugs, anything, help me out here. And I could tell she was a little evasive. What happened was they ordered online ivermectin. Now, ivermectin for scabies, the dosage is 0.2 milligrams per kilogram once a week for 2 weeks. This person was taking 25 milligrams of ivermectin every day for 5 to 7 days. In order for that to get out of your stomach and your gut, it takes 18 hours. This crosses the blood-brain barrier. It affected him neurologically. I actually don't know, and to this day, I don't know how long it takes for this to resolve itself. There is no antidote for it, so I don't know that answer. Now, ivermectin, it can be used and has been used in higher doses and has done fairly well as an antiviral. West Nile virus, yellow fever, it's been used for that. But I'm here to tell you, for COVID, this is what happens. Something gets online. Look, it's been effective for West Nile. It's been effective for some other viruses. Well, my gosh, let's try it. And so then it spreads. And this is what happens. So some bad judgment. People are scared. People are worried. legitimately concerned, and they will go to extremes to feel better. Ivermectin does not work for COVID at this point in time. We don't know an exact dosage to use. Please, for the love of God, stop pursuing it if any of you guys are out there pursuing ivermectin. And I know I'm going to get some feedback down here. I had a friend that used ivermectin. He got better. Well, okay. On day 5, he got better when he took it on day 3, but he got better by day 7. He was going to get better anyway. Okay? So I'm telling you, ivermectin. Horror story. That was my case right there. Okay. If you have any questions, thoughts, throw them down below. If you like the video, give me a thumbs up. I appreciate it. We're going to be talking about how to assess someone in the wilderness when they're hurt in a bad trauma situation. Coming up next. All right, guys. Keep your eyes on the rise and your face to the wind. Keep those masks on. Stay away from COVID. Take care.